So today is going to be the best day. This is the exciting day. This is where we take everything that we've talked about over the last couple of days, and we will integrate those. You guys should have already done your pre-start homework, which is all the information I asked you to go and gather before we started. And then we're going to take what we've applied in the last couple of days, plug it in to the same sort of thing, and then we're going to set our dentistry goals about. So we're going to be looking at short-term goals as well as long-term goals. We're going to be looking at the ways you can achieve those goals, and then we're going to set time frames on them. So the idea is that by the end of this session, and look, I don't know how long this session is going to last. Um, you guys probably know I do love talking, and once I get on a roll, it is hard to stop me. But everybody has been staying to the end, which is really awesome. So I'm very pleased to have you here. So at the end of this, you're going to be walking away with your own personal roadmap, saying the options that you're going to choose, the timeframes that you're going to apply to those, and what you're going to get out of it by the end. Okay, let's just recap what we've already been doing for the last couple of days. So day one was all about recognizing pathology and how we can set ourselves up for success with the 5 essential things that we need to perform a good dental. In reality, it's a whole lot more than 5 things. You need, your senses, you need your hands, you need your eyes, you need your brain to think, you need your ears. You probably don't need your tongue. There's no tasting involved in this whatsoever, so you can leave that one totally alone. You need speculum, you need sedation, you need a mirror, and you need a strong focal light. In addition to that, you also need the education. So you need to be able to recognize what is normal versus abnormal. And once you can recognize that there is pathology there, you don't actually have to know necessarily right then and there how to treat it. As long as you've identified it, you then have the opportunity to go away and, ask a friend, do some research, look up in a textbook, look at a course, whatever it might be, and then go back with treatment options. Because the worst thing that can happen is the horse has a dental, the owners go, tick, I'm a good owner, and my horse has had his annual dental. The horse has pathology that goes undiagnosed, and the horse misses the opportunity for that to be fixed. So I know I've talked at length over the last couple of days about how painful some of this dental pathology and dental disease is. And again, we became veterinarians because we love animals. We're equine vets, or we do a lot of horses because we love the horse. We really don't want them to suffer. So this is an incredible opportunity to increase the welfare of our patients by doing good quality dentistry. So we talked about the different methods there's actually been some good conversations in the Facebook group about how to get these sort of images, what lights are the best to use, how to clean the mouth, etc. We also looked at pathology and what that might look like in the mouth. So knowing that periodontal disease, of course, is the most common disease of the horse and how painful that can be. And we just talked a little bit about how to treat periodontal disease, and that kind of slid over a bit into the other days about looking for the opportunities in your practice. Like, how do you actually charge that out? I was speaking to another veterinarian, Tommy, I don't know if you're here already this morning. He's got a case that he wants me to see, and was telling me how he structures his pricing. So there's so many different ways to do it. So what I don't want you to do is just give your expertise away for free. That's really, really important. Excuse me. Okay, let me check. Let me keep an eye on the comments to make sure that I can respond in time. Okay. So we looked at what pulp exposures look like. That's one thing I definitely want you guys to take away from training like this. I know this is hard to see because it's got coloured lines over it, but this is what a normal pulp looks like. You can put a pulp probe or a needle and you can scratch it over the surface, and it's like the glass, it doesn't sink in. Whereas these pulps over here are non-vital or exposed pulps, and that indicates that the endodontic system, or that part of the tooth, is dead. Not to be confused with the infundibula just here. It's pretty normal to be able to put a needle into those. So if you are seeing these pulp exposures here, we do definitely recommend a workup for those in the majority of cases. In the absence of any other clinical signs, I wouldn't necessarily be recommending a workups for example, say your geriatrics, as long as there's no other clinical signs, because teeth don't last forever. Then we went into day 2, and it was all about radiography with a little bit of radiology. So I hope you guys got a huge amount out of this day, because like honestly, radiography is hard, and when you have to do the head, it's even harder. There's so many things you have to get right in order to get good quality diagnostic dental x-rays. You have to get your positioning right, you have to get your factors right, you have to get your orientation right, your quality assurance has to be good, all of those sorts of things. And ideally we would do this in as little time as possible and not have to expose everybody to radiation time and time again. Radiographs have made a massive difference in our treatment of dental disease. Even if you think back 30 or 40 years ago, how difficult it was to treat any of these dental problems without, just about everybody has digital x-rays these days, in the back of your car. It's an absolute blessing. And then we've gone even further recently with auroscopy, and that's really opening up doorways and making our treatments a lot easier as well. So we looked, so Randy is saying, an area of extreme frustration when I'm called to do a dental and we identify pathology that has been accumulated over years and the owner tells me they were done last year. Oh, Randy, I hear. I always feel so sorry for the horse when I see something and I know that they've been in pain and I know that it could have been prevented. But again, it is an opportunity to educate the client. I never make them feel bad. Sometimes they feel bad anyway, and I'm okay with that. Because generally the owners, if you think about it, how are the owners expected to know who to go to for a dental? How are they supposed to know? They do not know what we know. All they can hear and understand is what is being fed to them. The lay dental groups are doing a really good job about saying that vets are too busy doing emergencies and they're the ones that should be doing dentistry because they've had all this training, conveniently forgetting that we all have veterinary degrees and years of the underpinning knowledge systems, all of that sort of stuff to be able to treat veterinarians, to be the treating veterinarians. But yeah, the owners don't know, so it's up to us to educate them. I think we're behind in educating them, and the clinics that do really well with their dentistry, they actually take the time to educate their clients. And that was in the next day, but we'll just finish the x-rays first. So we looked at the different types of views that you could take. The DV and the offset DV are the two most underutilized views that you can take in dentistry. They're really important. And then we've got the 7 golden rules, even though there's only 6 here, so hoping you didn't count them. Sedating the horse, repeating your shot, opening the mouth, using fetlock factors, educate yourself on how to read them, practice, and the one that's not on here is take an x-ray of the other side. So we then looked at where the gold exists in our existing practice. So this is basically every case that you have to sedate for any other reason, bandage change, etc. Anytime you're doing vaccinations, poor performance, weight loss cases, etc. We talked about our lost and lapsed clients, and we talked about finding out what your clients want. We talked about what are you currently giving away for free. That sparked a really big discussion. And then we also talked about our existing A-class clients asking for referrals and getting rid of our C-class clients, the bottom-dwelling mudsuckers. They are just an energy and time suck. Randy, my issue is that they've had an exam by a veterinarian, so they assume they have received the best care available. That's a really, really tough one. So to finish my train of thought on that, I never make the owners feel bad, and I never ever throw anybody under the bus. I don't care who they are. They could be, it doesn't matter who they are. I never want to throw anybody under the bus, because yourself, when you go out to see a client and they're bad mouthing another veterinarian, they're going to do it to you. So Don't sink to that level, just stay above it. And my spiel on that is, okay, well, look, we've found it now, so we can't treat it yesterday. Let's treat it today and move forward. Educating the clients, is the biggest thing. And look, it may even be appropriate to, depending on what the relationship is by the other veterinarian, if you know them, to just give them like if you feel your dental knowledge is at a level where you can start, teaching and helping other veterinarians, reach out to them and say, hey, I saw this horse and I found this. It was, might have been there when you looked, it might not have been. Just wondering, do you know what this looks like? Do you want a hand to identify it? Do you want to come and shadow me for a day? Like, help the people that are walking in the footsteps where you've walked. I mean, that's what I'm all about. Um, I've, I'm totally getting off topic here, but what the hell? When I was studying, I was in first I was in an equine practice. Then I was in my own dental practice, and by then I'd had quite a lot of training and was starting to feel pretty good. But then when I wanted to take the next step, it was extremely isolating. And at the time, with two young kids and a practice and a farm to run as well, it was really, really, really difficult to get away. I was super lucky that I did get the opportunity to do a residency when the AVDC first started up. So I was able to do an alternate pathway, which means I didn't have to move to America, which would be really tough if you're trying to earn a living on a practice and have a young family, etc. But I did have a couple of people there that really extended me a helping hand, and one of them I want to give a massive shout out to, and that's Dr. Larry Kimberlin from Texas. We have a mutual friend, and she reached out to him and said, I actually needed some small animal cases for my case logs for my residency. They had to be an American diplomat at the time, so obviously they're all in America. She reached out to him and said, this is Olivia's position, will you help her? He didn't know me from a bar of soap. He said, come and stay at my place for 2 weeks. I will teach you all of the small animal stuff. He was actually a dual registered small animal and equine veterinary specialist. So I lived in his house. I went to work with him every day. He set me up in the back room with all of the cadavers, so I could do root canals from sunrise to sunset on these small animals just to get my case logs in. Um, and I'm forever grateful for people like that were able to extend a helping hand. So if you are ever in a position to help someone, to help another veterinarian, to help an owner, please do it. Makes you feel really good as well. And at the end of the day, it's going to absolutely lift the bar for our profession. So, if Larry didn't help me then, I might not have be able to be in the position I am now. And now our programs, we have a reach of over 60 countries, which is like blows my mind. But we're all veterinarians, so we're all just one big community, which I love. So anyway, enough about me. But the take home for that is that if you are in a position to help other people, absolutely, please do it. Okay, so we looked back on track. Sorry, guys. Let me have a sip of water. But this is real life, right? You're not talking to a robot here. We looked at a simple conversion framework. So this is looking properly with all of the things we talked about with doing a good exam, finding a pathology, showing the client, making clear recommendations, making it easy for them to say yes. The vast majority of owners really do care deeply about their horses and want to help them. We just need to make a pathway for them to make it easy. Educating your clients. This is such a big part of what I've been talking about in the last couple of days. Educating our clients is every consult, every touch point is a chance to educate our clients. And honestly, they're starving for education. They are absolutely starving for education. So if we can offer them some education, we're doing the right thing. So we talked about client education nights. We talked about the use of social media. There's newsletters. There's talking to pony club, 4-H groups, adult riding clubs, having stands, even just having maybe some of your newsletters at the local feed store, produce store, something like that. There is just so many opportunities to educate people. Um, I did mention social media before. Facebook Lives are becoming quite popular these days. So, you know, especially with the rise of AI, um, it's still at the stage where it's very obvious that it's AI. But if you are there with a patient and you found something, take a video of it, post it up there. Of course, get permission from the owner as well, but it will be raw, it will be real, and man, your clients, they really love that. Okay, I want to skip on to this bit now. So, do you remember the example I gave you yesterday with Dr. Mary about what it would look like with increasing the average transaction value? So, she went from 400,000 to 480,000 and was able to increase her profit from, I think it was 480 to 180,000, I think. So, if you if you have been the sort of person that did the dig-in homework, just go and grab that for me. If you haven't got it, you can go and just scroll down on the Facebook group and you can download um, today's workbook. And I just want to take you through an example here, but I'm going to get you guys to fill this in for what your practice is. And I want you to see, I kind of want to just open your eyes to the possibility of what could be if you actually are paying attention to this. So I'm going to work through an example here, and a pretty average solo practice that's doing doing a little bit of dentistry, but they want to get better. Um, they're also busy doing repro and podiatry and, colics and stitch ups and things like that. So let's see about a typical practice, what it might look like. So this typical practice does 300 dentals a year. So not a huge amount, but definitely it's more than other practices, of course. If they are charging $185 a dental, which is at the low end, I'm going to have to be honest with you, it is definitely area dependent. So if you're looking at that going, gosh, I'm already 250, or gosh, I'm 120. I'm just taking a little bit of an average here, so don't be too worried about this. This is really intended to be just an indication of what the maths looks like. So don't think this is going to be exactly you. I did decide when I was filling this in to present this to you, we're not going to increase the repurchase frequency. Just to keep it simple, we're just going to times it by 1. I didn't have enough time to actually take this out of the PowerPoint, so I've just put 1. So just roll with me on that. So right now, this practice is doing 300 dentals a year at $185 a dental, and that's getting them $55,500 revenue every year. And if we were to increase the number of dentals we're doing by just 10%, which is not a lot, that's 30 dentals a year. That's one every, what's that? One every 2 weeks is less than one every 2 weeks. That's not, that's easily achievable, easily. If we went and we got a 10% increase in our dentals, but we also increased our the average that we're charging per dental, that bumps it up to $203, which is not a huge increase, right? It's not a huge increase at all. It's, what is it, $17, $18. So we ignore this 10% increase. We just kept it at 1. That increase with the number and the revenue just got you an additional $11,000 revenue, which goes straight to the bottom line. So that additional $11,000 revenue over a year is going to be a pure profit, 100% profit. Okay. If we then go, Robin, it doesn't matter what currency this is. I do a lot of business coaching, I guess worldwide. I've got clients from USA, Canada, Australia, New Zealand, Finland, like everywhere, right? Generally speaking, $1 in Australia is equivalent to $1 in the US, but you just need to apply it to wherever you are in the world. I don't convert it into different currencies. Some of my mastermind members are in Denmark, for example, sorry, Sweden, and to translate it to Swedish kronans is really difficult. So we just keep it as a value. So, you know, whatever currency you're talking about, just apply it to yourself. Okay, have a look at this. If we made a 20% increase, which is a little more than one dental a week, so that's 60 extra dentals a year. There's 52 weeks in a year. So yeah, it's a little bit more than one a week, 1.1, for example. If we increased our price by 20%, which is $222, which again is easily achievable, definitely location specific, and there's a whole lot of factors we have to consider before we start, you know, before we go from 185 to 222. That will give you nearly $80,000 in revenue, which is an additional $24,500 profit every year. So if you are earning, you know, whatever profit you're earning in your practice now, you can add 24.5 grand to that just by applying some of the things we've talked about in the last couple of days. Then even better, if we increase by 30%, which is definitely achievable for somebody who wants to really get serious about dentistry, doing another 90 dentals over an entire year is entirely possible. If you also applied this to your the 30% increase to your current average dollar spend per dental, so it'd be 240, that would get you $93,000 revenue, which is an additional $38,000 revenue. So this is absolutely huge. One thing I wanted to point out, right now we've got, let's twist it a different way. We're talking about our average dollar spend per dental. When you know more, you do more, right? Everybody knows that. When you know more, so you're diagnosing more pathology, you are going to be performing more diagnostics. You know, the biggest one is going to be X-rays, and I've already said that around 20% of our patients should be having dental X-rays. That's 20% of the population will qualify for having dental X-rays. Teach you a framework on how to get your clients to ethically say yes to that. So we actually don't even have to be putting our prices up for our dentistry. It's the simple fact that you're performing more diagnostics and that you are likely going to be performing more treatments, and that might be perio treatments, it might be extractions, it might be surgeries. It is not a difficult thing to imagine how you could go from 180 to 240. That is not difficult at all. And so you could even leave your dental prices exactly the same. It's just that you're doing more. In reality, this is low-hanging fruit. This is so easily achievable, it's not funny. It really is. You just have to have a systemic framework to be able to do that. So, what have you guys found in, I would be interested to hear some of your numbers. So, I'll give you a minute now if you want to do the maths on this, or the math on this. I'd love to know what increase that you think you can achieve over an entire year if you applied some of these principles to your practice. So I know we're going to get a lag here, so I'll take a minute to have a drink. So let me know. Let me know what you came up with. And if you're shy about it, just put a range. And if you haven't done it, just imagine what it could be. You could even make it up, because honestly, this is the exciting thing about business that I was talking about before. It's the time that you spent sitting at the desk or at the kitchen table, thinking about how to make this better, that really makes the difference in the long run. It's not about working harder. It's not about working 7 days instead of 6, or 6 days instead of 5, or 5 days instead of 4. It's not about that at all. It is really difficult to have a really good life by just working harder. So, I would encourage you to be really strategic about this. I just can't tell you, it's a game changer. So this is about working on the business rather than working in the business. If you are an associate, not a practice owner, just guess at these numbers. If you might not have your if you might not have your figures in front of you. But this is also a great way to show your practice owners if you want to go and get some more education, if you want some more equipment, this is how you pay for it. This is the way that you get your horse owners to be able to give the practice the funds that they can invest in the education and equipment, and in return the horses get better care. Like it's a total 360 win-win. It's good for the client, it's good for the horse, it's good for the veterinarian, it's good for the community as well. So it's a really wonderful thing about paying attention to this. So Audrey did a bit under 300 in dentals at 74, so 22,200. Yeah, yeah. So Kate snowboarded the sidewalk on Monday and wore my flip-flops on my walk this evening in North Central South Dakota. Okay, so it's hot there. That's what I'm hearing. And Kirsty, starting from scratch is reasonably exciting on how to work smarter in quiet times. Yep. Rachel, 2025 did about 35,000 in dentistry revenue without even trying. Okay, I didn't advertise that I did this. Okay, you got some great opportunities. Everybody here has got some great opportunities here. So that's pretty awesome. Okay, I'm pretty excited for you guys. Okay, so just to remind you, you already have the clients, unless you're a new practice, in which case you have to go and find the clients. You already have the opportunity, and this is all about shifting from just checking the teeth to delivering really good care. And please stop giving your expertise away. Martha is saying, as a solo who's busy, yeah, busy, I hear you on that one, and not equine exclusive, I do around $120, 120 dentals a year. If I could just increase the number by 30%, do it. It's so doable, it's not funny. Every single equine patient in your practice has a mouth. It's as simple as that. And keep base prices the same would increase my revenue by 10 grand, and that would not include the increase in dental x-rays. Yeah, and I would say that that is an extremely conservative figure for sure. Randy, my fees are 15 for charting, sedation 65 includes top up, routine dental 125 and extra pathology 45 each. I'll be increasing my routine to 135. Yeah. Yeah, okay, so putting it up $10, yeah. And do you know what? I actually challenge people a bit on this, and I'm going, well, if you're going to increase it $10, why not $12? Why not $12.60? You know, where does it stop? We don't have to only go in these round numbers. And if you're looking at increasing it by $10, I mean, in reality, gosh, we could go on to I've got to think about what to say here because man, I could talk about this all day. But what does $10 buy you these days? Like a cup of coffee and a cupcake? No, that's probably more like $18. So really, what does $10 buy you? Um, yeah, so and you can't take your horse to the grocery store for a dental or for x-rays, right? Jacqueline, 187 dentals per year average transaction value, I think that's probably meant to say. ATV, 175, great. Okay. Wonder what it would look like if you could get that ATV to 200. It's it's $25 extra. Yeah. Makes such a difference. This I can appreciate, guys, how sometimes like this is, this might be new for a lot of you, and a lot of the time we are just guessing on this. There's a couple of ways to set your prices. Gosh, this is a whole nother lecture. I've lectured on this before, various places over the world. You can have your cost plus based pricing, which is what it costs you plus your profit margin is there. You can have your value-based pricing, which is this is how much it's worth to the client, and that's about really how much will that market bear. And then the last one, and unfortunately this is the most common one, is that I'll just charge what my neighbour is charging or what my previous practice has charged, and maybe I'll just make it a bit less so I get more clients. Like it's just such a, I mean, I understand the sentiment there, but man, that is an absolute race to the bottom, and it's a race to see who can be the busiest and have the least work-life balance and just be stressed out all the time. It's not a great way to live. Yeah, mentally, owners don't seem to note or balk at increases with decimals as much as round numbers. Just totally true. Totally true, Martha. Okay. So dentistry roadmap. So there's kind of, you could make this five things, but I've just made it three. So there's kind of three categories that most vets will sit or fit into. So one is that they're doing routine work. They are doing oral exams. They are floating. They're doing they're doing the basics with confidence. Um, there's the second level, which is where you're doing more of the diagnostics. So you're doing the radiology, you're doing more of your diagnostics and treatments for periodontal disease. You're making better decisions, and you're having better conversations with your clients. And then there's the third level, which is more the advanced level, doing complex stuff. So it might be doing extractions, you might be doing some surgeries, some, definitely more advanced work. You might even be only halfway to routine. You might have got, one lecture at university if you were lucky. You might have been exposed to some dentistry. You might have just been given the gear and your owners packed you off to go and do 10 dentals on your first day. Say, good luck, see you later. Unfortunately, that is a real life example. I know somebody who was sent off with no training and just all the gear and sent out with a nurse to say, do 10 dentals on your first day. Yeah, luckily that person actually loves dentistry now, but man, what a awful thing to do to a new grad. So you might be not even at level one yet. And you know what? That is okay, because there is not a single one of us that was born good at what we're already doing, or was born knowing what we already know now. So the key to our own education is that we're just continuing to learn every single day. So let me know where you are in that one. If you are if you're a number one, number two, number three, or even if you're less than number one, or if you're halfway between. Maybe you're a 1.5. Where do you rate yourself on that scale? I know for a long time I was at I was stuck between one and two, and I did find that I found that to be a really, really, really frustrating zone, because I wanted to get better and I wanted to get more confidence with what I was doing, but being by myself, it was really hard because I didn't have somebody there to say, yes, that's good, or no, that's terrible, or hey, have you thought about doing something like that? Um, and at that time, we really only had one textbook, and that was I've got it here on the shelf. This is the textbook that we had, and you can see it's well loved. It's well loved, because I carried it around in my car for such a long time. And now I don't know if you can see that. I went through it with a highlighter because I was using this for studying. Um, that's basically all that we had at the time. And this was, considered the Bible. We've got, I mean, gosh, look at some of these X-ray pictures there. They're really old, right? Thankfully, it's got so much better since then. But that's what we had. So Chris is a 2.4. Randy used to schedule 8 to 10 a day. I've even done 12 in a day. Now only six. Yeah, allow time for doing extras. We've got a 0.75, struggling with confidence in grading infundibular caries and pulp exposures. You don't grade pulp exposures, but infundibular caries, once you understand the system, it's so simple. It's so simple. It's how many dental materials are affected. Cementum is grade 1, cementum and enamel is grade 2, cement and enamel and dentine is grade 3. That's it. That's it. A grade 4 is when you lose structural integrity. So you have what's the word for it? When the two infundibular are both open, and that's when the tooth will split and you'll have to take it out. So hopefully that's a little tip there. So we've got a 1.5, a 2.3, 1.5, 1.5, and Randy has that book. The falling off the page. I'm sure I've missed some just here. It's only showing me 5 at a time. So anyway, yeah, okay. So everybody's kind of, at very different ranges. And I saw there was Audrey, we between a 2 and a 3. This is a really exciting zone to be in. This is the gap between getting, being really confident with your diagnostics and then getting the chance to go on to do the more advanced stuff. And Audrey, that's exactly why you're part of our virtual internship right now. So very excited to have you in that group. You ask amazing questions. Okay, so dentistry roadmap, we've kind of, between this and the work that you guys did in the pre-start, you've kind of worked out where you are, right? Okay. Then the next couple of steps are going to be, okay, well, I'm here. Where do I want to be? And by when? So we're going to be setting for everybody, or you'll be setting them yourselves, some short-term goals and some long-term goals. Okay. So look at that. We're already here. So this is where you make a decision on where you want to be for a short-term goal and a long-term goal. So what are the things that you want to be able to do in the short term? So I'm talking, up to 12 months. You can make it 6 months if you like. And sorry, I can't remember your name and the comments have fallen off now, but for example, to be able to confidently grade in fundibular caries, what sort of time frame do you want to be able to be good at that by? And then oh gosh, I can't even spell goal. I've written foal. Never mind, you guys know, you understand. Your long-term goal is what do you want to be able to do within a longer time period, say 2 years, 3 years, for example. So short-term goals might be to be able to take good dental x-rays, and that could be a 6-month goal. It could be that you want to start doing, if you're between level 2 and level 3, it might be that you want to start doing some more extractions. It could be that you want to be able to feel good about treating your periodontal disease. It might be that you want to reduce your dentals from taking an hour to taking 40 minutes. I know when I first started, it would take me an hour to do a dental. The nurses hated it. Yeah, Ariana, given how many dentals I'm seeing at the moment, 3 to 6 months seems realistic. It might be that you want to increase your dentals by X% within X months. So what does it look like for you? So I'll give you guys a couple of minutes to fill that in. Just I might even just stop talking for a minute so you guys can think about what do you actually want to be able to do. Don't think about how just yet. Let's just think about what do you want. When you're ready, I'd love it if you could let us know in the comments about what your goals are. You don't have to write out the whole sentence. Randy does most in the field, so I have to decide if I want to get mobile stocks or build a referral centre for the molar extractions. Molar and premolar extractions, yep. Cheek teeth. Yeah, there's a good company called Blue Mist Equine that exports their trailers to the US that I can recommend. Let me know if you want their contact details, Randy. Short term, 6 months to take good x-rays. Long term, do some younger horse extractions and teeth that aren't loose confidently. Great goals. And extracting full incisor arcades and endodontic capping. Yep, doing some pop capping of incisors under 2 years. Yeah, awesome. Extractions, great. Where are you up to with your extractions at the moment? Are you doing, and sorry, it's listed as DE, so I'm actually not sure what your first name is, so I can't address you as that, sorry. Let me know where you're up to with your extractions. Short term, 20% reduction in swear words during molar extractions in the next 6 months. I think you mean cheek teeth because we've got premolars and molars, but I 100% hear you. And look, I'm not afraid. If I've got a really difficult dental, I'm usually able to keep my calm pretty well, but I do let off some steam by swearing, and then I kind of I mean it's not intense because I'm usually pretty calm, but I also put in the bit of a joke there that the more times I swear or the harder I sweat, the more money I'm going to charge for it. So it kind of lightens the mood a bit. I refer most but want to start, awesome. So great place to start is your geriatrics that already have loose teeth, because so many of them have periodontal disease, and they've done half the work for you. Yep, more thorough charting. Yeah, charts are a big thing. And also, just remember, as veterinarians, the legal documents as well, we have to be making good dental charts. It's a definite liability not to do them. Short term, get good on radiographs, and long term molar extractions. Yep, cheek teeth extractions, because the first three cheek teeth are premolars and the last three cheek teeth are molars. So just an important distinction there, because a lot of lay dentists will just say molars. Short term, become more relaxed with extractions, allow time for the block to work. CRI in the field is a grey area. What do you mean by that? Yeah, I think CRIs work great, especially if you've got mobile stocks. 6 months, increase my dental numbers, especially my home clinic repro setup. I like to utilize the facilities I have, get better equipment to diagnose and treat perio. Yeah. Kate, my short-term goal is to be able to take diagnostic radiographs within 12 months, long-term to be the dental referral in an area in 3 to 5 years. That's freaking awesome, guys. These are really, really great goals. Really, really great goals. A lot of the time when I teach, people think that I want everybody to become a specialist. And you know what? I absolutely don't. I don't know if I would. You'd have to have really, really, really good reasons to want to do a residency and be a specialist in this. You'd have to be very passionate about it and be prepared to give up so many other areas of your life and your practice. I really think the sweet spot for horse vets is in GP practice. I honestly do. I think the GP veterinarians are the total unsung heroes of our profession. The people that are there at the trenches doing all of the things for their horses. Martha, short-term, good dental x-rays in 6 months, long-term, be able to treat periodontal disease rather than refer out in the next 2 years. Yeah, that's great. Martha, I even think that with perio, for example, you could probably put that into a short-term goal. So, getting your sedation right and getting your diagnostics right, that's probably one of the things that are lower hanging fruit. Marie, being able to increase numbers for more exposure to relatively normal pathology, doing cheek teeth extractions, of course, mostly mobile geriatric teeth. Let me have some coffee. Cheek teeth extractions, but I'm also doing increased numbers of younger horses. Currently, no radiograph machine, relying on colleagues for that. Sure. So Marie, even looking at the 3 ways to grow a business, if you want to raise some funds to buy an X-ray machine, that's the way you can do it. And the good news is you don't have to apply these principles to just dentistry. You can apply them to everywhere in your practice. Everywhere. Like honestly, so for those of you who are already in the online dental program, the Ultimate Equine Dental course, or you're thinking about joining up, you probably already know that as part of that, you get a one-on-one consult with me, and we help you to set your pricing. We help you with your marketing ideas, and we help you with the equipment that you need and the equipment you don't need, because so many people spend money they shouldn't be on equipment that's just not suitable for them. So I meant to say that before, but I went off on a total different tangent. That with setting your prices, it does depend on other more local factors in your area. So I can ask you some questions, and I've got pretty good at this now. I've done hundreds and hundreds and hundreds of these consults. Is I can give you an idea about where I think you should be sitting for your prices, and it doesn't have to be just dentistry. It can be other prices as well. So keep that in mind. I think for a lot of people, it gives them a lot of confidence to be able to say, yep, I think this is a good place for you to sit, rather than, you just making it up. But it's totally up to you. Randy, if I set up a CRI and things go well, I'm left with a bag and a lot of product, then I may not be able to use. Yeah, so if you're doing extractions, for CRIs, I tend to put 5 mils tetramadine, 5 mils butorphanol in there, in a 1 litre bag of saline. And if you're doing an extraction, that volume of sedation would be appropriate if you were giving it off the needle. So you're really not spending a whole lot more. You've got, a couple of dollars for the bag of fluids, you've got your giving set, you've got your short-term catheter. So I wouldn't necessarily recommend reusing those between different patients, but if you do have more than one patient on the day and you put a clean giving set in there and you are very confident there's been no backflow, I think it's okay to use that bag. It's probably safer to chuck it out and start again. But the owners are paying for it. So, and if it's going to give the horse a better experience and stabilize your sedative levels, then it might be something to look at. Jacqueline diastema burring. Yeah, that's a tricky one. That's a really tricky one. You can't make mistakes on that. Okay, that's excellent, guys. That's really, really good. Okay. It doesn't matter, Audrey, what size fluid bag. You just adjust the rate. So I will routinely use a 1 litre bag because that's what's most commonly available here. I know other people using a 500 ml bag, and the rate of administration is a lot slower. I wouldn't. Yeah, if you're talking about using 5 litre bags, I've never done that. I don't know if it's necessary to have the horse on IV fluids for standing surgery. So I would just look at a 1 ml bag of saline and do 5 mils citomidine, 5 mils of butorphanol. I know there's been a bit of conversation about the benzos, diazepam and midazolam. Just remember you can't mix that with any other drugs. It's got to be in by itself. Okay, so do not put that in a CRI. Okay, now is time to make a bit of a commitment. So on the slides that we've done over the last couple of slides, what's your ideal revenue? So this is the bit where you write down on a piece of paper or here, right here in the group, if you want us to help you keep accountable for this, write it here on the group. Because if you think it, it's a thought, but if you say it, it's a different story, right? So your name, commit to achieving my ideal dental revenue, and just make it per year. So whatever that revenue is, and just put a date in there. So we're going to start with that either here in the group or down on a piece of paper. Randy, I have so many questions. Do you use packing after opening a diastema? Randy, I don't. The questions are fine. I love questions. I don't use packing after opening a diastema. Yeah, you might find it difficult to keep packing in there if the diastema is open, because that's the whole point, is opening that space up. Sometimes, very occasionally, I'll use them in very, very deep periodontal pockets where I've already x-rayed it and decided there's no extractions are needed, just as a bit of a band-aid to give that granulation tissue time to fill in. But I don't routinely use any VPS or any packing in there. But I have before, but I just kind of found over the years that they did just as well without it. Washing the mouth out is one of the more important things. So the next bit of this is, and you can take a screenshot of this. I'm hoping you guys are writing it down. How are you going to do that? So you will achieve this by increasing your number of clients by how many? Increasing the average value of a dental by how much? Probably just leave the increasing frequency of visit. That's might just be complicating things a little bit too much for now. So this is the bit where you're going to make a commitment to yourself or to us or both ideally to achieve your ideal dental revenue and by what date. And if you're watching on the replay, please make sure you do this as well. It's so easy just to sit back and just go, I'll do it later. Because you know what? Later never ever comes. You got a less than 1% chance of doing that. And we know that 89% of statistics are made up. So I did totally just make up that 1%, but it feels pretty true, right? You'll just never do it. So either do it now or don't do it. That would be my advice. So if you are watching us on replay, just use the hashtag replay. Will be super cool. So how are you going to do that? What are you going to increase your number of clients by? And some of you have already written this on here, so that's pretty cool. Increasing the value of an equine dental by how much? And by increasing, and we're just leaving the increase of frequency of visits. So I'll keep moving forward. I know you guys, you probably finished this by now, but I know that there's a bit of a lag because my Facebook group that I've got open on the side here still shows me like 5 slides ago. So that's okay. Okay. Um, no, if you're on, can you let me know if I'm still live on Facebook? Because it kind of looks like it's finished. Or if you can somebody tell me that if we are still here? Because looks like it's finished. And I might be here talking to myself. We have just hit over an hour, so I don't know, or almost an hour actually. I'm not sure. You're live. Okay, thanks. Great. It was, guys, it just got really quiet in there for a minute, and I'm like, oh no. And on my screen, it's got one of those play things, so it's looking like it was finished. Okay, appreciate that. Thanks, guys. I'm not here by myself. Thanks. Okay, let's go forward. So I did mention to you guys that there is an opportunity, thanks Nova, an opportunity that if you guys want and you're interested and you want a hand with this, if you want a structured pathway, hi Diane, hey Shelley, um, a structured pathway on how to get what you want with your dentistry, I'm going to show you one of the options that's available for you. So if we're having to think about our goals up to 12 months time, so if you could transform your practice and stop having to always second guess yourself, I mean, am I setting the right price? You know, am I taking the right X-ray? Am I doing the diagnostics? Am I recommending the right treatment? Then the opportunity for you here today is to earn lots more money in your practice that's going to pay for the investment in education. It's going to get you that equipment that you want, you know, that shiny oroscope, the brand new DR X-ray system to fit in your car so you can take dental X-rays, for example. And a lot of the time you can do these and you don't necessarily have to always keep referring your cases out. Some of them, of course, you will, but there's so many things in practice that you can actually do right there in the field that are not necessarily referral level. So with the Ultimate Equine Dentistry course, and actually this slide's old now, really need to update that because that number is much, much larger. So I think it's approaching 1,500 veterinarians have been through various levels of the online training. And these guys, we're a pretty small community within the group. I know these people by name, right? They're telling us that they can get back 15 to 20% of their investment in their first year. You know, it's just incredible how powerful this training is because the training is a structured pathway. We teach pathology, diagnostics, making decisions. We also talk about practice management and marketing, and everything kind of all gets in there and fits together so you can actually go from where you want to go to where you want to be in a completely structured pathway rather than just getting random bits of information from everywhere, journals, YouTube, articles, etc. So I know that there's a heap of you that are either in the dentistry course or doing the virtual internship or have done it. Diane, you're another one of the virtual internship people, so good to see you from France, but here in Australia right now. If you've done that before, maybe just pop a comment and let others know how you're finding it or how you found it or what it's meant for you. I'd really appreciate that. So there's a couple of different options for you. So one is the Foundation Essentials, and this is 3 modules, and the entire program is RACE accredited. So you can also tick the box on getting your RACE credits for the year. And this is going to take basically from the complete basics, which by the way, the basic people want to do advanced stuff, the advanced people want to do basic stuff. And I can't tell you how true that is time and time again. When I was putting this together, I was almost at the end of my residency, and we've got lecturers, over 30 different lecturers that put this course together. And I remember sitting there just going, wow, there's still so much I don't know, even talking in the basic lectures. So please don't think this is going to be too basic for you. This is applicable to absolutely everybody. And then the second option is the Platinum upgrade, which to be honest is where all the really good stuff is. So you would have received this ebook here, but I think there's 7 ebooks in there now. You do get a bonus lecture with every single module that's in there. So this is, I think we're approaching 100 hours of training in here, but it is broken down so that it's not overwhelming. The lectures are about 45 to 60 minutes each. Some of them are shorter at 30 minutes, and we're basically drip feeding this for you, and it's structured in a way that you can learn from the beginning and keep progressing through the levels to get to the end, to be where you want to be. Yeah, Audrey's saying the lessons are great, very visual with lots of different cases and pictures. Yeah, it is really important to me that this is clinically applicable. I don't consider myself academic. Writing a journal article in order to complete the whatchamacallits for the residency is one of the hardest things I had done in my life. It was awful. I hated it. So yeah, but working with horses with my hands and understanding what I'm seeing, that's where, you know, that's what I really love. And so for me, it was really important that people would be able to take this information, learn it today, and like literally go and apply it the next day at their very next case. And that connection from learning to doing, you know, is a light bulb moment. So really, really wonderful. The course and internships are game changers if you want to perform equine dentistry. Thanks, Marie. The experts that Dr. James has put together is phenomenal. That's awesome. Thanks so much, Marie. I really appreciate that. Okay, what else have we got in here? Oh, there's if you guys haven't seen it, as part of start again. The dentistry program has been closed to new members for the last couple of months. Some of you have already found out that it's open, even though we haven't, I don't think I've actually told you, we haven't advertised it, but it's only open for this group here doing the 4-day challenge. And we're going to keep the enrollments open until Sunday, midnight Pacific Daylight Time. So you've only got, what's that, 4 days? 5 days, is it, to enroll, that if you're thinking about it. After that, we're closing it back down again, and we won't be opening it up for another at least 6 months. So there is a new module in here, which is some of the more recent advances, which is things like fissure fractures, which is what we're seeing a lot more of on oroscopy, how to radiograph the TMJ, how to do a vital pulpotomy. This is not difficult. So if you've got a horse that's been kicked in the face and it's got a fractured incisors, you can do a vital pulpotomy on that. You're just putting a dressing on it, basically. Dr. Easley is giving us a lecture on bitting injuries. We've got oral antral fistulas. This is a really good one. This is performing occlusal relief burring. So this is one of the biggest advances that we've had for treating periodontal disease in the last 10 years. And it's really easy. Anybody can do it. So there's a lecture on that one as well. Diane saying the program is amazing. All the lectures are done by passionate veterinarians. Aren't they ever? They're so passionate. And I knew I loved dentistry. I just didn't know how little we knew. It's resourceful, and the program helps to understand a lot. And with this information, you feel confident to give the best treatment for the horse. Yeah. Thanks, Diane. That's awesome. Like literally, guys, I put this together because this is what would have been the missing piece for me when I was trying to get better at dentistry. And there was just no options available. So I'm like, okay, well, this is what I would have wanted. Let's see who else wants it. And as I said, there's been over 1,500 veterinarians taking part in this training from nearly 40 countries around the world. So we do give 100% money back guarantee on it. And for the dentistry program, like honestly, we've never ever had to do that. I've had more. I think it's 2 cases now of people that have gone through the program, and they've actually sent me an email and said they have a confession to make, that they bought this intending to do the whole course and then asked for a refund, and they got to the end and they said it made such an incredible difference in their practice and in their lives that they couldn't do it, and they wanted to release themselves of the guilt and the burden of carrying that. And I think that's freaking wonderful. So I'm really, really proud of that 100% money back guarantee. What else do you get in here? So I've kind of touched on over the last couple of days what else that you'll get in here. So your complete set of reference radiographs, so that's all there for you. So you can actually look there in the field and go, my x-ray's crap, this x-ray is good. What's the difference between these two? What do I need to do? So that's really, really, really useful. And some of the bonuses that you are going to get if you want to sign up before Sunday. So we're going to give you the proven marketing strategies. We've talked, Honestly, the stuff that we've talked about in the last couple of days hasn't even covered 3% of what is available in this program and what is available to make our dental practices and our equine practices absolutely outstanding. So we are really just very lightly skimming the surface. There's so much that we can do in here. So we will provide for you client education PowerPoint, and for the first time ever, we're going to also provide for you a client education PowerPoint on first aid. So I mentioned that majority of veterinarians who enroll in this program and actually, follow the instructions or follow the steps and do the client education night, they tell us that they pay for their investment in the course on that first night. Like, it's super cool, right? But for the first time ever, we're going to give you 2 PowerPoints, because if you offer just something on dentistry, you won't get a good attendance. But if you offer something cool like first aid with gory wounds and things like that, oh, clients love it. So that's a done for you presentation. We've put together a 12-month client education newsletter pack for you. So these are 12 newsletters with information at a client appropriate level with images. And that's what you can send out either in your newsletter or as a standalone newsletter. It's a chance to educate your clients once a month. And that's also supported with a social media pack. So we've got our social media images, we've got blurbs on there for you. And I said that we're going to give you 10, and one of my team members sent me a message overnight saying, why are we only giving them 10? Like, come on, you got way more. So I'm like, okay, 220. So I'll have to finish making them today, but I can definitely get them done for you. That's fine. For signing up, do we join the waitlist online, or is there a separate something we should be looking at? Yep. Nova, could you post the link, please, to the page, because I'm not sure if the main page has the waitlist or if you need to go to a separate page. So Nova will post the link in there. That would be awesome. Thanks, Nova. But that's a great question, Martha. Thanks very much. So this is an example of some of the social media assets that we have created for you. And this is a massive thanks to April, who's one of our new team members. She's only been with us for a little bit here. So this is how to recognise EOTRH on x-rays, and we've also got some little blurbs there. And these are going to be supported by your newsletters. So your clients will see your newsletters, your clients will see the social media posts, and you will very quickly then become to establish yourself as an authority. This little logo here is a placeholder for your logo. So you can brand these to your specific practice. Looks like it's coming from you. So as I said, there is 100% no risk money back guarantee, and thanks, Nova. And these are all race accredited as well. I think it's 65 race credits you can get. So we've already given you the how-to guide on radiography. So there's another 6 ebooks inside there. Okay, so if you go to your workbook now, let's go and have a look at, so you've set your short-term goal, you've set your long-term goals. What are some of the ways that you can achieve this? What are some of the avenues that you've got? And I have to apologise for this slide because it was supposed to be blank, and then you guys were supposed to fill it in, but my IT skills have fallen short of my dentistry skills, and it's already populated. So anyway, maybe try not to look at it and you can just go and fill that in. So where can you go? What resources do you have to get to where you want to go with your dentistry? My suggestion is the first thing to put on there is that you guys are here. You're in the 4-day challenge, and that has been a commitment of your time and your energy and your involvement in the group. So I just do want to give a shout out and recognize you guys for making the effort to be here, because you could just as easily be watching TV or doing something else, washing the dishes, I don't know. But you could be doing something else. There's lots of other things that we could be doing with our time. So I appreciate you guys for taking the time to spend here with me today. So some of the suggestions are 4-day challenge. That's going to get you at least started, and at least, get some enthusiasm for really looking at your dentistry and ways that you can improve it. Part of the challenge is to take a certain number of x-rays over the next 4 weeks. So whatever your number is, how are you going to track that? Are you going to mark them somewhere in your practice vehicle, in your diary, on your phone? Where is it going to be? You can invest in your education. There's things like the course that I just mentioned, the Ultimate Equine Dentistry course. Honestly, we have such a good deal going for you guys at the moment. With all the bonuses that are in there. So if that is for you, wonderful. It's there for you. Enrollments close on Sunday. If you're not sure or you think absolutely not, look, go and have a look at it anyway. And if you've got any questions, just send me a DM, send me an email. I'm around, and then I can, of course, answer those for you. My recommendation is that for the people who are going to take the opportunity and sign up, go and book your one-on-one with me as soon as you can, because right now the momentum is high. Let's keep going with that momentum, and we'll help you implement this straight away. The other things that you can do, source some journal articles. So if you're a member of any organisations that give you access to journal articles, you can use that as a resource to increase your education. You'll have to go in and find the journal articles that relate to what you want to learn about, but you can put those together. You can read textbooks. There are a couple of textbooks out there. You can search YouTube. Be careful on YouTube. There are a few lay dentists, and there's one particular veterinarian who I'm not going to name, who is very, very vocal on YouTube. But some of the information they are putting out there is flat out wrong. Like, it's absolutely flat out wrong. So just be very, very careful about that. You could find an experienced vet. You could take some time off work and go and shadow them. Like, this is actually, it's a great opportunity. Go and shadow them. You'll learn a huge amount. So what are the ways to achieve your long-term goals? What are you going to need? Again, you can source some journal articles. You probably need to purchase some more gear if you're going into the more advanced stuff. I can definitely help you with what gear to buy, and more importantly, what gear not to buy. You can take some more time off work and attend, oh God, I really can't spell. You can attend wetland. Okay, good luck with attending wetland. Wet labs, that's supposed to say. Attend conferences. AAP is a good example. I've put in four abstracts to speak again this year. So if you are coming, come up and see me at AAP. We've got a stand there as well with the Equine Practice Company. For those of you who really want to turbocharge your dentistry knowledge, we do offer the virtual internship in equine dentistry. It does only run every 2 years. The exams are this year, so we won't offer the next one until till late next year. So you have some time for that one. And that will get you ready for membership exams with the Australian New Zealand College of Veterinary Scientists, which are memberships by examination. They are virtual exams. You don't have to be there in person. And thanks, Martha. The typos are amazing. This is real life. This is my crazy life. Yeah, so that will get you not only I mean, both Audrey and Diane can testify to this, but going through the virtual internship, not only are you doing the online dental program, you're also doing the virtual internship. We're meeting regularly, we're really challenging ourselves and providing you all the journal articles and everything that you have to read, and we're about to do some practice exams. If you are the sort of person that goes, okay, I like dentistry, I don't want to be a specialist, but that could be pretty cool. Have a think about that. It's a little while away yet, and I would encourage you to really take that time to increase your education before even thinking about that. But the Ultimate Equine Dentistry course is, they just totally dovetail in together. So I would recommend getting started with that. Yeah, and that will get you post-nominals, which is at M, stands for member, MANZCVS, and then brackets equine dentistry. Again, that just demonstrates to your clients that you've got a higher level than the average veterinarian when it comes to this. So very exciting opportunity just there. What else have I missed here, guys? What are the other opportunities that you could do to achieve your short-term goals and your long-term goals? There's probably stuff in here I haven't thought about. Yeah, Audrey's saying virtual internship, lots of reading, meetings are great, can bounce off ideas. We also have a private Facebook group where we all share our cases. Yep, 100%. Thanks, Audrey. Okay, there is still a lag, so I'm going to keep going. We've been talking for a while here. So basically you have two options here. You can 100% you can go back and do this by yourself. No problem at all. There's textbooks, there's journal articles, there's courses, there's wet labs. Go and find a way that works for you. Or you can come and join us in a proven pathway. So a proven system that takes you step by step by the hand, walking you through the entire thing. We'll give you those extra bonuses. We'll give you all the assets for the client education nights, the newsletters, the social media assets, the bonus module 7, the reference radiographs, the 7 ebooks, the gosh, there's so many other things in there. That go and have a look at that at that URL, because I can't remember all the things that are in there, but go and have a look at it and see if that might be for you. We do find that for a lot of people, it's the fastest way to get to where they want. They're both good systems, but the ultimate online equine dentistry, it's going to be a faster system and it's a proven framework. Plus, you're going to be getting to join the cohort of the guys that are in here. So on after Sunday, when this ends, people who are not a member of the dental course, well, you'll be unfortunately taken out of the group. But the people who are members, both previous, current, or new members, you will stay in this group, and so you'll have that cohort to go through all of this together. So I'm pretty excited about that. It's a really nice place to be able to post. Often people think, I don't want to post this because it's really silly, and it's actually not, but it's also nice to have a small group to talk to about that, because more often than not, other people are in exactly your position as well. Okay, what else have we got here? That's the end, guys. Oh my goodness. Um, okay, I've been talking for 1 hour, 20 minutes, and you're all still here. That's super cool. I love that you guys stay on.